Well, we're back. And today, as I always say, we're going to go deep because this is the den. Astrologically, I'm a Leo. And of course, I would have a den, but I have a den where I go in with people that are just amazing and so informative and here to help and just to really enlighten you with regards to information that you may never have thought of. So, we're going to go deep. And today, my guest is Gina Mundy. Now, I hope I've pronounced that correctly, Gina.
You
And
did.
great. She is a powerhouse. And I'm talking powerhouse. I've done a lot of research into this lovely lady. She's a powerhouse attorney, best-selling author, and the leading voice in childhood safety. A passion of mine is children. And so I couldn't be more honored. For over 23 years, Gina has moved past the tragedy narrative to analyze thousands of medical records and delivery outcomes, uncovering the systemic failures that turn the most joyful day of a family's life into their worst. She isn't just an advocate, she is an architect of safer future for parents. Today, we are going to pull back the curtain on these medical patterns and discuss how we can reclaim our agency for and during our most vulnerable moments. Gina, welcome to my show.
Thank you for having me, Colli. And I feel already speechless from this introduction, and I really appreciate the kind words.
Well, you are so deserving, my dear. You are so it's absolutely, like I say, it's an honor to have you. I'm not going to get into some of the things I've experienced because I want our audience to get to know you first. But I was going to say, you have, wow, analyzed thousands of medical records and delivery scenarios. So when you look at preventable mistakes, do you see a recurring systemic pattern like in how these teams operate? Or is there something deeper, like a cultural blind spot in our medical system?
Both. But the first question, there are common facts, common things that happen in the baby cases. Unfortunately, I've done this 23 and a half years. And from the first case I got to the last case I got, it's the same things literally occurring over and over and over. So I started to recognize these patterns.
Hmm.
And I used to obviously tell family, friends, watch out for this. Oh, you're getting an induction of labor. Be careful of this. Be careful if you're going to have them break your water, because it's usually after they break the water that something goes wrong. And then a lot of stuff came to light. And that's when I decided to write the book. So
Wow.
instead of just being involved in the aftermath of something going wrong,
Hmm.
the intention of the book, like you said during introduction, is to get on the front end of this and advocate for, how advocate to parents, actually to
Right.
teach them how to advocate, to have a healthy baby, to, be able to enjoy, which for most people is one of the biggest days of their life when they get to meet, their son or daughter. And
Hmm.
there are things that they can do to make sure they have a healthy baby. And that's why I wrote the book. And that's why I'm sitting here on podcasts like this. I have my own podcast that I like to talk about this stuff.
Right.
Anything I can do to prevent a family from going through, what I've seen these families go through for 23 and a half years. It's life changing, to say the least.
Wow. Yeah. I want to know how you chose this field.
I wish I had a better story. I
Oh,
was
no.
supposed to be I was supposed to be business real estate attorney, and basically in 2002, I graduated from law school, I took the bar exam, I passed the bar exam, and started to look for my first job. Well, it's almost like when you graduate college, sometimes you just need that first job. So I found a firm,
Hmm.
very big firm, it was one of the biggest firms in Michigan, and I applied at the big firm, and they're like, "Well, we have birth trauma open." I'm like, "Don't know what that is, but sounds good." And that was February 2003 I started. And what I saw was, I mean, it was unbelievable. They don't teach you about this area of law. And when I tell people I'm a birth injury attorney, birth trauma attorney, many people don't even understand what I do.
Yeah,
Uh,
I
so
can understand how, because it's just not out there.
it's not. And unfortunately, a lot of people don't even look to people like me unless something devastating happens during labor and delivery. So, yeah, so that I started in this field and I never looked back.
Amazing. I love it because life really directed you, you know? It was like, you are the perfect person to do this and we need you. So obviously you filled that role beautifully.
Thank you. I
Yeah.
appreciate it more than you
Yeah.
know. I do feel like this is what I'm supposed to be doing in life. And
Mhm.
I have a bunch of colleagues that are birth trauma attorneys. It's a small world of birth trauma attorneys. And I know, they're great attorneys and they're in the grind, but that's it. And,
Mhm.
I'm, trying to do this one step farther. I'm trying to put us all out of business. So so then we can all go be our, the business real estate attorneys,
Right.
that we were supposed to be. So that would be nice. I'm not sure that's gonna happen though. But
Well,
until then, I can at least be out there helping in any way I can.
that's awesome. I mean, like I say, I have my own daughter who went through hell and with the birth of my first grandson, her first son. And so I know that there are many others that have as well. And honestly, I was in a position at that time where I literally wanted to strangle her doctor. Like I mean, I was in the room with her. It was over a 40-hour labor, and it just went on, and everything that they wanted to do and tried to do. And I had to intervene at one point. They were going to do a forcep, and I said, over my dead body. And she was so out of it by that time because she had been in labor for so long. And so at that point, had I had the information I have since known through knowing, and researching you, I mean, I would have been on the phone. You know what I mean? Like, seriously, like it still till this day sends shivers up my spine and goes, it shouldn't be this way. It just shouldn't be this way. And so I am so delighted to have you because I know, like, my audience, which is now your audience, will completely be onto this. Like, there are a lot of mothers and a lot of mothers who have daughters that are expecting, et cetera, right? Or even daughter-in-laws. So, yeah. So, yeah, like you say, the joy versus the trauma gap, right? I mean, you work in, oh goodness, the intersection of extreme joy and extreme trauma. And from your perspective as a litigator, what is the single, like I'm looking for the single biggest missing link that prevents parents from truly advocating for their own safety during labor?
I wish I knew. And I don't know if it's the way, society is and, doctors are up on a pedestal, they know best, listen to your delivery team or whatnot. But, sometimes just the failure or the failure, I don't want to say failure to advocate.
Mhm.
I think that they don't have the big picture and understanding that this is literally the biggest moment of their life. This is, we were all, I know when I was a little girl, I had all of my baby dolls and I used to just dream of the day that I would have, my baby or, these days my granddaughter
Mhm.
and and this precious little life and how just simply a couple simple advocacy strategies could just make such a big difference in the whole experience in and of itself. Since I've been in this world, I have a lot of, moms who have pretty tough deliveries, their inductions of labor. Sounds like your daughter may have been an induction of
Yeah,
labor.
yeah, absolutely.
Did she end in a C-section or did
Yeah, C-section. It was down to the final push, with my grandson, and I mean, literally, when the doctor came in, and said, "We're gonna do a forcep," and that's when I said, "And what is the alternative?" Right? And here I am, she was so out of it. She was so drugged, and she just was crying, "Mom, I don't know what to do." And they were, basically scaring her into this forceps situation. And when I said over my dead body, I meant it because of the fact that my husband, ex-husband now, although we're really good friends, his mother had a forceps child, and the baby died 24 hours after from a ruptured artery. And
Oh,
my ex-husband, my daughter's father, he was born, 10 months after that. But she went through devastation and grief, and
oh,
it just horrible. Like 24 hours later, you are saying goodbye to what you just gave birth to, right? So that's why I said what I said.
mm.
And when I looked into the doctor's eyes and said, what's the alternative here? And he said C-section, because there's no way this baby's coming out, right? And so that's when
Oh,
my daughter said, "Okay, just take me, take me." And, her husband and her went in. Yeah.
and baby's okay?
Oh, yeah, he was great. Baby was great. I
Right.
mean, bruised, unbelievably bruised because he had been trying so hard, I mean, to get out. And he she was in the bathroom, perched on a table, the table that they give you for your lunch and dinner or whatever, and she was sitting, on the bathroom stool and just crying and saying, "Mom, mom," and just the baby's pound it was a nightmare, and it didn't have to be that way. It really did
No, it
not.
didn't. It
No.
did not be that way, and it's scary. And, just to go back to how we got down this path with
Mhm,
advocacy, whatnot. So, induction of labor, and this is actually a question, one of the first questions you asked me, are there common themes in these baby cases? And there are.
mhm,
Almost all of the birth injury cases involve the drug Pitocin and
mhm,
are a result of induction in labor. So, if you're going to have an induction of labor, there's very important things that, as a mom or a grandma, grandmas
mhm,
love my book, by the way,
mm,
because they are mama bears and they are the great advocates in the room for their daughters many, many times.
yep,
But Pitocin is huge. It's important. There's a whole chapter in my book on how to have a safe Pitocin induction. But let me give you this example. On April 13th, when my granddaughter was born, my daughter actually wanted an induction of labor and she got it.
mhm,
And and she obviously knew that this is the big, this is when things go wrong. So we got to do it right. And she
mhm,
trusted me to watch. So that day, Pitocin's in for your audience, just to let them know, Pitocin's very easy to understand. It's an IV drug that goes in you. They basically start at 1 and they go all the way to 20.
okay,
Now they can put orders in to go above that, but typically it's a 1, starts at 1 and goes all the way to 20. Some doctors go up by 1, some doctors go up by 2. So you can go 1, 2, 3, 4. You can go 2, 4, 6, 8,
mm,
or whatnot. So with
okay,
Pitocin, especially with a new mom like my daughter was, you want to go slow and steady. We don't know how her body's going to react to Pitocin.
nope,
And they like to just start the protocols and start the Pitocin and just boom, 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 boom. And that's how a lot of these emergency C-sections happen.
right,
So my daughter is on 2. The nurse came in not very long after they had her at 2, and she came in and she starts playing around with the Pitocin, and I knew it was Pitocin. I'm like, "What are you doing?" She's like, "I'm going to increase the Pitocin to 4." And I said, "Well, hold on. We just started, and it's Pitocin. Can we give it some time to work?" And she looked at me and she was speech now, the whole hospital knew what I did. Now, I went in there, I'm in sweats, no makeup, my hair is in a bun, type deal. So
yeah,
I wasn't, like, scary looking or anything. Well, maybe scary
no,
and not putting
no,
it on to myself. But, I look like a normal person. I
yeah,
wasn't, all decked out in a suit or anything, trying to control the room. Anyway, the nurse just, "I am gonna be right back," she says. And then I got another nurse come in. She's like, "Hi, so what's the problem with increasing the Pitocin to 4?"
mm,
And I'm like, "Because I said, I don't know what do I have to sit and explain it? Do you want my book?" So we're going to go slow and steady, and we're going to go up by 1. Is that a problem? Because if it's a problem, please get the doctor. And so there was actually a minute where she didn't. We waited a little bit longer, and then she did come back in. They increased it by 1, not 2. But so that went to 3, and then a little bit, well, I mean, this is a while. They slowly went up to 4, and that was it. That's all she needed. She delivered with no more than she only went to 4 with Pitocin. Now you can go all the way to 6 with Pitocin, and that's your best bet at mimicking your natural spontaneous contractions. But my daughter only needed 4. She was good. We just sat on 4 for a little bit, and she had the baby naturally or vaginally, and everything was great. She even had an epidural and so forth. Now, her friend delivered at the same hospital with the same practice the week after.
Mm.
Apparently, she didn't read my book because she let the practice go 2, 4, 6, 8 with a so she was there for an induction. She allowed the doctors just to quickly increase the Pitocin, the nurse actually runs the induction, and they just went boom, 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 up, 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 emergency C-section.
Oh,
Uh,
my word.
right, so Eliana has this my daughter, has this beautiful birth story that's great because the advocacy was simple.
Mhm,
And the
mhm.
nurse, when they were a little bit in shock because clearly nobody does this, they don't question them.
No.
And the other one was the family then calling everybody mortified, that what had happened. This resulted because when you have, the biggest day, when they're rushing, oh, you're part of this. Is the baby, your thought process, is the baby going
Mhm,
to be okay?
mhm.
It's emergency C-section. It's go time. It's we gotta get the baby out. And, in those thoughts that should never enter your mind during labor, do, and it's scary. And then they're moving fast and that whole, and then the baby, you gotta get the baby out, check the baby, make sure baby's okay. But, just simply just understanding a Pitocin induction, saying, "This is what I want." Or, another one is breaking the bag of water.
Mm.
The doctors always try to I'm sure they broke your daughter's bag
Yeah,
of water.
yeah.
So when things go wrong with during labor, it's always after the water breaks. That's a huge decision. Doctors act like it's nothing. Mo they're supposed to ask you or tell you, give you the option of breaking your water. Many times they just tell you they're going to do it, and they do it. So and I'll tell you I was very upset, and I almost don't wanna talk about this because I was so mad,
Mhm.
but, my daughter wanted an epidural, which is fine, that's her choice, and,
Yep.
with everything, I don't tell anyone, "Don't do this or do this." I just try to inform them, like, "Hey, if you're gonna do this is what you need to
Right.
know." So she wants her epidural. So she's allowed to have one person stay in the room. Of course, I raise my hand and I'm like, I will be in the room watching closely. And my
Mhm.
daughter is, she's by then having her contractions pretty strong. And she's like, Mom, I want the doula to be in the room. And I'm like, what?
Mm.
Well, doulas are very, touchy. Let's breathe through contractions. I'm not even touching my daughter because I'm uptight because she's, because it's hard. I
Yeah.
usually see the bad outcomes. And I'm watching, the fetal monitor, and she's like, "No, you're not staying in the room, the doula is." And I'm like, "What can go bad if I have to leave for 15 minutes?" Well, they they started her epidural, the OB was in there, went down, broke her water.
Oh
I
my
was
god.
like, "But we wanted the water intact. We all talked about this." So, but of course, then they get scared to tell me probably they gave her permission. I assume the doctor asked for permission and they just didn't know what to do, but they're too scared to tell me because that was not the plan. But it's probably because the doctor was like, "It's not a big deal. It's gonna jumpstart your labor," and whatnot. So, but anyway,
Amazing.
yeah, it's so you just have to understand because if I was in the room like I should have been, I would have
Mhm,
been like, "We're not breaking the bag of water. We don't
mhm.
need to break the bag of water." So when the water breaks, obviously it comes out. and it changes the intrauterine environment because baby's
Mhm.
in the uterus, the placenta, the cord, the water. Well, the water comes out, it changes that environment. But how does it change it? Nobody knows because it's inside mom.
Yeah.
So that's why you just and sometimes there are changes that can be bad for baby.
Oh, I'm
So
sure.
keep it intact as long
Yeah.
as you can. That's my advice.
It's there for a reason,
Yes,
right? It's there
it
for
is.
a reason, and
Yeah.
it comes when it comes, and it breaks when it's supposed to break. It's the
Mhm.
forced manipulation that and I'm sure it changes, the pH balance, everything, right? It
Right?
has
Oh,
to.
yeah.
Yeah, it has to. I mean,
100%.
oh my god, it's like such psychology and of the delivery room, right? I mean, in your experience, how does the hierarchy, right? Within a delivery room, the power dynamics between doctors and nurses and mother contribute to the silence that often precedes a medical error. I mean, there's got to be this hierarchy.
Well, you know what's fascinating about that? This is so fascinating. There is a hierarchy. The doctor's the captain of the ship. But the way our medical system is, the doctor pretty much just rolls up to deliver the baby.
Mm,
Now, they will come in depending on when it is. They'll come into the room and check on you. They may do their rounds here and there. I sought out a practice that actually has an OB at the hospital
mm,
24/7. That's very rare. But even then, so the doctors, whoever was on staff, did come see her throughout the labor. That is extremely rare. Doctors typically do not come in. They're doing their other stuff, they're practicing or whatnot, or unless they're coming in to deliver a baby or check them, then they may come and check. But doctors don't really come in until it's really time to catch the baby. That's most practices. So what you are left with are nurses.
mm,
And there are some born to be labor and delivery nurses, the best people I've ever met who are absolutely amazing. And then there's other nurses that, there was one nurse in a case, she had just started being a labor and delivery nurse and she hated it and she was looking for a new job.
mm.
So that day, it was luck when the patients would walk in labor, it was luck of the draw. One got the really good nurse who was born to be a labor and delivery nurse. The other one hated her job and was looking for a new job.
Ugh.
So obviously that lawsuit involved the one who hated her job. So, the dynamics can really, you know, change depending on who the nurse is and
Mhm.
whether oh, I apologize. My dog is supposed to be on the
Oh, don't
outside
worry about it.
of the,
You know what? It's all good. This is all
is it
natural. I don't edit things,
okay.
so just we
Well,
go
it's
with
funny
it.
because 'cause I'm like, well, no, I don't wanna, like, scream at him because it's kinda scary when I yell at him to be quiet.
It's
But
okay.
anyway, I apologize.
It's okay.
Um, but going back to your question with the whole dynamics and whatnot. So, you have a really good nurse by the bedside, and she's communicating great with the doctor. You have less of a chance to, something bad to happen, but you have that nurse who could have cared less about being a labor and delivery nurse. She wanted to go be a different kind of nurse. She's not going to contact the doctors, as much, or she's just not, she doesn't probably, they say it takes about 5 years for a labor and delivery nurse to figure out exactly what they're doing. Because,
Wow.
oh, well, you get it, all these moms are different, they have
Yeah.
different complaints and whatnot. So you get a new nurse like that, it can really change the dynamic, and it did in that case because it turned into a lawsuit, and unfortunately, in that case, the baby actually passed away in that case. It was awful.
Oh my
Yeah,
god.
it was very sad. So, and then there's another dynamic that comes into play sometimes, and that's residents, the doctors who are in training.
Mm.
Doctors have to get training sometime just before they become a doctor, so that's your residence. Whether it's, Canada or it's the United States, these, they it's a whole new element of, different kinds of people. Now, I would not let my daughter deliver at a teaching institution,
No.
because I did not want residents to be part of her labor, and I feel bad. They have to well, I shouldn't say I feel bad. They have to have a way to train. They just weren't gonna train on my daughter because, obviously, I'm a birth
Yep.
injury attorney, and they probably would've been scared to death anyway.
Exactly. So the whole dynamic, all the energy in the room would have been very tense, right? Yeah.
Yes.
Yeah,
Yes.
absolutely. I mean, yeah, I get it. I know, you know, yeah, they've got to learn somewhere, but they're not learning on my daughter,
Mhm.
right?
But
It just,
okay, and that also keep it sometimes I say things and I'm like, I probably could have worded that different, but keep in mind, my life is just the 3 bad outcomes that happen in childbirth, which, are, the baby passes, the baby is permanently injured, typically having to do with the brain, and
mhm.
then because there are shoulder dystocia cases where the nerves from their arms can be, kind of pulled, and then moms will unfortunately pass away during childbirth. So
Yeah.
those are my 3 scenarios. And so, yeah, so it's hard. You see the bad only,
Mhm.
and I try to decrease that as much as possible.
Oh, for sure. Really, you would think, I would like to think that in our world, this day and age, with everything that we have technologically, as well as information and experience and all that, that a lot of this would not happen anymore, but it does. It does.
You It's the same. I'm telling you.
Yeah.
The stuff that they do, the fetal monitoring. Actually, they tried to and some hospitals do use this. They actually try to use it on my daughter. They now have wireless fetal monitoring. So the important and just so your audience knows, fetal monitoring is actually very important during labor. I've had many, many doctors testify and tell me, Gina, the only way a baby can talk to me during labor is through their heart rate.
Mhm.
So
Mhm.
and it's true. I can look at a fetal monitor and I can tell you if baby is a rock star, and I can tell you if baby's in trouble. I can tell you there's certain things that happen on a fetal monitor that indicate a baby is well oxygenated and other things that would indicate baby's not
Right.
oxygenated. So what they did, because it is important, is they created this Monica system where it's wireless, so mom can walk around, which is great. Mom can walk around and then still baby's still on the monitor. But unfortunately, that has not worked out as planned, and there are some pretty so it came out, I believe, around 2016, maybe 2017. So you think, better technology, this is great.
Mhm.
No, there's some glitches in it. So unfortunately, that monitor is extremely dangerous and has resulted in the death of many infants.
Oh my
So
goodness.
if anything, it's like let me put it this way,
Backwards.
yeah, they've gone backwards when it comes
Right.
to safely delivering babies, when it comes to technology.
Crazy. I mean, my great grandmother was, I lived in a very small, well, it's a province. In Midwest Canada, and lots of land, lots of snow in the winter, lots of cold, not the best roads. Some are okay. But my great grandmother was the first midwife here. She came over
Oh,
from,
no way.
yeah, she came over from Poland, and she delivered, I believe, from my auntie that just passed away last year. She had told me that it was like 130 some babies. And she used to do is in the summer, she would grow poppies, and she would crush the poppies
Yeah.
for the opium, right? And she would take sometimes the horse and the buggy, and sometimes she would walk miles and miles in snowstorms and deliver babies. Like, I'm like, wow, you know, like super.
That's oh, I
Yeah,
love that story.
like she literally horse and buggy, and sometimes her husband, my great grandpa would put in the really, really cold blizzards, he would heat up rocks because they had a mud hut, literally, like a mud hut, and he would heat up rocks to put in the back of the buggy and then blankets over her when she drove off to do the delivery. It just brings tears to my eyes. I just would love to meet some of these people that were, brought into the world by her, but a lot of them would be deceased, but even their children and their great grand or their children and grandchildren, right? Like, it's just, I go, wow, what a woman. What a woman.
What a woman, that's an understatement.
Yeah.
Wow.
I know, right? And so when I had the honor of connecting with you And, I was just like, "I gotta have this lady on here," because it's children are very dear and near to my heart, and yeah, it just and to have someone, you know, such as yourself that is who you be, let alone what you do is like amazing to me. So I can't thank you enough for doing what you're doing. I really can't.
Thank you.
And I know our listeners will be glad to know you too. So oh my
I
goodness, it's
appreciate that. I appreciate that more than you know.
oh well, you deserve it, girl. You really do. So my listeners, some of them are you know, pretty high achievers and some they're just rolling along and that's okay in life, right? And but the high achievers especially, I think of, they're so used to being in control. And I've been called a control freak myself, so I get it. Especially in the room with my daughter that night. But in childbirth, control is an illusion, right? Because you just can't you just can't control this. So what is your
Really.
take on what is your take on being controlling in that room?
So it's hard
Mhm.
because moms, and you got to think about this just common sense wise.
Mm.
Moms go into a different state of mind when they go to deliver their baby. And anybody who's been pregnant can relate to this because I've been pregnant 3 times. And I remember always looking at my belly going, how is the baby going to get out of me?
Mm.
Well, the way the baby comes out of you is you literally go into a different state of mind. And even going back to my doctors who have testified, they'll say in some situations, given whatever's going on with a certain mom, the
Mhm.
standard of care, what's required by these doctors is to give her options before she even goes into the labor and delivery room because she is in a completely different state of mind. I
Oh,
actually quoted that doctor in my book. His testimony is in my book because so you're right. I I'm like, "Wait a minute, you guys gotta advocate, you gotta do this." Well, hold on, mom is in a completely different state of mind.
absolutely.
She's trying to deliver her baby, and the key is and my daughter had one too, you have a doula. You have a grandma. You were the advocate that day
Mhm.
when they tried to put the forceps on your grandson, and you
Mhm.
were like, "Over my dead body."
Yeah.
Perfect. You just have to advocate. Who cares how you're doing it? And you know what? It was obviously a really good decision because in the end, your grandson was okay and he was healthy.
Yeah,
So
and
that's
still
what
is.
matters. But,
Yeah.
because of how moms, and going into this different state of mind in labor, and I watched it with my daughter. I
Mm.
was, I had C-sections.
Okay.
So I did go into labor for the first one. And then they just sectioned me. It was pretty quick, and probably has to do with being a birth injury attorney. And so it's really important that dad, somebody else is in that room to be the second set of eyes on mom,
Mhm.
just
Mhm.
like you were that day.
Yeah.
So, yeah, the extra person is huge.
Oh, yeah. Well, because like you say, there's no control when you're in an altered state, right? Because it's like
Mhm.
so much. I mean, there's so much going on within one's body, let alone the mind, right? And trying to make sense of it all. It's yeah. My daughter was born C-section as well, right? So, I mean,
Mhm.
I can just reminisce of the night that it all came together, and it wasn't supposed to be that way, but it ended up being that way. And yeah, I just was
Yeah,
like,
that's actually mhm.
I was
It's
gonna
in my
say,
book. It's in my book because that's why that whole state of mind that you just brought up and you're talking about and how do you keep control? Because it
mhm,
is so hard. One of the ways to have a healthy baby is to, have that other person. And if dad doesn't want to do it, that's fine. I love doulas. Do you guys have a lot of doulas in Canada?
we need more. The laws have prevented the more from coming through, but now they're opening it up more because they're realizing we need more. Go figure.
Mhm. You, I don't, that is ridiculous.
I
That
know, right? I
laws against doulas. That
I
I don't even know what to even say about that. That's
well,
ridiculous.
exactly, right? It's like my great-grandmother, midwife. like, what are you going to stop this woman from going through a snowstorm to deliver a baby that probably won't make it if she's not there?
Mhm.
Like, it's
Right.
crazy to me as absolutely. I just, you know, I I have to laugh because when my daughter when I was in labor and then, on the operating table and the epidural was about to happen, I just said to the anesthesiologist, I said, "Hey, can we just call this a day and let's go to a bar and have a couple drinks?" Because
Oh, you're so fun.
'cause when I saw that needle coming, I was like, "Dude," he says, "Look, sweetie," he says, "you got yourself into this, and the only way out is like this." So I was just like, "Oh my god," but I had to make fun of it because I was like, that needle was huge. Oh my
Mhm.
goodness. But, yeah, you just have to and that was my way of knowing I'm losing control because I'm out of control because I have no control. So, yeah,
Yep,
just yep, absolutely,
pretty
go with
accurate.
it, right? Yeah. Absolutely. So, oh my goodness. So you've moved, from the courtroom, right, to Safer Childbirth community. And
Yes.
so what does a truly how can I put this? What does a truly informed parent look like in your eyes? And how does that information fundamentally change the outcome of a birth?
So I'll tell you, the parents in the cases, the birth injury cases, it's always the same.
Really?
They well, yes, and I'll tell and it's so sad. They say this is not me. They roll up to the hospital ready to deliver the baby, and they're just ready to follow instructions. That's it. No preparation whatsoever. Something bad happens. They then educate themselves, and they're so much more educated on the entire way labor works, childbirth works, that in your heart, and they know too. Had
Mhm.
they known this information beforehand, their outcome may have been different. Their baby may be here. Their baby, may not have had an injury. So it's all the time. And it's information about how labor works. It's information about, like we talked about, the fetal heart rate. Understanding that, hey, if you do want to see how your baby's doing, just look
Yeah.
at their heart rate. That's
Wow.
really. And an induction of labor, well, that's when things go wrong. So you better know how to look at the heart rate and know if your baby's okay or not. And it's very simple. You can look at a heart rate and if it's kinda doing these ups, where there's these little hills, they're called accelerations.
Mm,
Well, guess
mhm.
what? If your baby keeps accelerating, that means their pH is 7.2, and layman's terms, your baby's well oxygenated and doing great,
Wow.
okay? But then if you see these dips in the heart rate where the baby's heart rate keeps dropping, especially with contractions.
Mhm.
Contractions, so baby's in the uterus, and the uterus is contracting down on the baby.
Right.
Well, baby can only handle so many of those. And in a natural labor, fine. But when you have artificial contractions in a labor that's not natural because mom's on Pitocin, that's when baby can get in trouble because the uterus keeps contracting down. And every time the uterus contracts down, baby's oxygen stops. Now, nobody freak out.
Wow.
Babies are made to handle contractions
Right.
from a natural labor. Babies, on the other hand, if mom's contracting too much, which happens if the Pitocin goes up too fast,
Mhm.
baby can't handle that. That's your emergency C-section.
Okay. Wow.
But it's understanding, hey, having okay, wait, things can go wrong when I'm having an induction of labor. Well, wait a minute. What is Pitocin? How
Mhm.
do I have a safe induction of labor? What does that mean? Talk to your doctor beforehand. Hey, when you guys do an induction of labor, do you increase Pitocin by 1 or 2? Make sure that sitting there that day, you only want it up by 1, especially if you've never had Pitocin. Everybody's body reacts to Pitocin differently.
Mhm. Mhm.
It's things, knowing, like I said earlier, the water breaking,
Mm.
huge. And there's other things too that parents have to realize is when things go wrong, oftentimes majority of the time, the labor and delivery units are very busy. So think about it this way.
Oh.
You might be at the hospital, let's say 2 floors above, it's like a surgical center. Well, guess what? Everybody is scheduled for surgery and they staff accordingly, right?
Mhm, mhm.
Labor and delivery is not that way whatsoever because you have situations where mom's coming in labor, babies come and babies wanna come.
Right. Yep.
So you get a really busy labor and delivery unit, that's when the eyes are off the prize. And
Mm,
that's when you don't have that close monitoring because things can change quickly in labor, especially
mhm.
like we talked about, the water breaks,
Right.
things change. And if you don't have somebody in the room who understands what's going on, again, that's when bad things can happen. And that's why in 23 and a half years, I have never had a doula involved in a baby case. We should
Wow.
tell that to the lawmakers in Canada. And
Yeah.
why are doulas not involved in childbirth cases? I mean, and let me tell you, if they were in the hospital, if they talked to mom over the phone, they would be in the case because 'cause they'd be a fact witness. They're nowhere. None of these moms have doulas.
Wow.
I know for a fact doulas help parents bring their babies safely into this world.
Right. Right.
Otherwise, doulas would be in childbirth cases, and they're not. So it's things like that,
That's
and you know what?
amazing.
Even if a family's like, "Oh, I can't really afford a doula." Well, guess what? If you read, grandma, dad, sister, best friend, if you read this book will give you enough information to avoid all of the complications, the mistakes that I have seen for 23 and a half years.
God, I wish I woulda had that book when I was with my daughter. Really, I do, or had read it
Yeah.
before, because I'm really curious to know what is the urgency in raising, going from 1 to 3 to 5 to 8, is it because they want that baby out so quickly?
Yes, there's no other reason but that they would
I
do
mean,
that.
obviously, it's like, "Hurry up, get this kid out of here and, next." What else could it be? To me, that's, like, horrible. There's
Yeah,
no.
it is,
Yeah.
and, it's just like my daughter's friend. That's what they did, 2, 4, 6, 8. They no one said, "Pause," and
Wow.
her beautiful day she's dreamed of since she was a kid playing with baby dolls, blew up in her face. So, luckily, she is okay, and just like your daughter, and just like your everybody's okay,
Yeah,
but
but it
it's,
could have been a lot better.
mentally,
Oh,
it's really tough, and it's lasting. My daughter, there's it's I know we talked about this. I think you were calling, we were talking when we were getting ready for this show, but they left the placenta in her for 3 weeks, and
unbelievable.
and
Unbelievable.
I she was with me, and she that morning, 7 a.m., the dad came they were here because I was helping with the baby the first 6 weeks, that was the deal. I'm like, "I'll do 6 weeks," and, which I would actually love to do more, but I have to work,
Mm.
and 7 a.m., they came to get me, the dad did, and he's like, "Something is wrong with Eliana," and I'm like, "What are you talking about?" And she's like, "Mom, I feel like I'm contract" so this is 3 weeks after,
Oh my god.
3 weeks after, and she's just like, "I feel like I'm contracting, like, the pain goes 10 out of 10, it goes away," and I'm like, "Well, you have a doctor's appointment, ironically, at 1 o'clock today. Just wait for the doctor. Let's just go ask the doctor why apparently you're having contractions." And she had them all morning, and it was very odd. She almost thought she was it was making it up in her head.
Mhm.
Why would she be contracting? She has no idea the placenta's in her. And then she goes to take a shower, and right before she gets in the shower, she just has this urge to push. She gets on the toilet, delivers the entire placenta into the toilet, which turned the bathroom, by the way, into a complete crime scene.
Oh my
She
god.
screams. The dad is like, "Do you want me to call?" He just opens the door and it's like, "I'm calling 911 because it looked like a crime scene." I'm running in. I'm like, "Whoa." And, even just trying to figure it out, but that whole scene was a disaster. And then
Nightmare.
right. And then I know it's been in her for 3 weeks. So I'm, grabbing the kitchen silverware jars and getting it out of the oh, it was so bad. And then we had to get it up to pathology, to see, but then, how traumatic was that for her?
I'm lost for words. Like, I cannot understand how they did not wait for that placenta to come out.
Yeah. Well,
Like, what?
it's interesting. It was the doctor who delivered the baby. It was, she's an amazing person, and her shift ended right before the baby was to be delivered, but it was my baby. We're friends. Or my baby, it was my grandbaby, I should say.
Right?
And I think she stuck around to, deliver my granddaughter.
Mhm.
And so then this is my granddaughter, her shift ends at 10. My granddaughter's born about 10:30. She's been there for, well, actually, I think 8 hours, and I think she's just trying to hurry and all right, and then she can go home. The other doctor had come, had started their shifts, so they were in charge of all the other patients. And so I do think it didn't come from a bad place. I think she was just trying to hurry. They took her back for a DNC, just trying to get that placenta out, but then we were told the placenta came out. She actually told me it was 1:03 AM, by the way, so now she's 3 hours past her shift. She goes, "I don't know how you have a healthy grandbaby."
Mm.
She's like, "The whole placenta's calcified." She's
What?
describing the placenta to me, how bad it was. So, we don't even know what she was talking about or what she took out.
Oh my god.
I
This is
so
like a nightmare.
Yeah, so it ended okay, and, just to finish the story with my daughter, unfortunately, then the next day, she went very, very septic, and she lived, but unfortunately, she became very ill and then was on IV antibiotics for a while, and then very, very strong oral antibiotics, so, that she couldn't breastfeed anymore, like, her
Oh.
milk dried up, so that whole again, she is okay, baby's okay, but that whole experience of being able to breastfeed your baby and have this
Mm. Everything
beautiful
everything ripped out from under her.
yeah, so that's and I think that's when we had talked around that time because I'm like, this
Mhm.
first we have a placenta and then we have septic. So
Un
sepsis.
and you doing what you do. Like, this is like, you can't make this up. You know what I mean?
No,
You
no.
just cannot make this up. And I wouldn't wanna be making it up, but it's reality, and it's so I'm, like, dumbfounded because I'm going, "Are you kidding me?" Like, I go back to in this day and age that this would be left unattended to, and then this horror story of this calcification, and I mean, when you took the placenta and they did the pathological testing on it, everything was okay?
Yeah, very well, it was very necrotic. That was very it was like just dead tissue. It
Well,
was
it's been in her for 3 weeks after the fact, right?
yeah. Whole
Wow.
placenta.
Unreal, unreal, but it is real. This is the thing, and,
Yeah.
it's oh my goodness, praise so good that she is healthy and the baby's healthy and finding her way back to they say for a woman after we give birth, it's, 2 years, and then sometimes it's almost 4 or 5 years before we come back to, you know, uh, who we really are, our identity, right? Because of all the hormonal shifts and everything, let alone all the trauma that she went through. Add that in, right? So
Right, I think that's what we were yeah, been, like, talking about, just the trauma from
it's
something, she was able to get through her we get her we get her through labor
mhm,
without the trauma, without the emergency C-section, everything's great, PIT never
mhm.
goes above 4, life's great. The only thing she never did feel good after she delivered, but also because they were trying to get the placenta out. So they had taken her back for DNC, and then she actually lost a significant amounts of blood.
Oh,
She
for
was yeah, she had blood transfusions.
oh, the poor girl. Like, I'm just my heart goes out to her. Like,
Yeah.
really, it's so much to go through, especially when like you say, you're playing dolls one day, and one day you having a dream of having children of your own, and da 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 da, and then that day comes and it's a nightmare. Like,
Yeah.
it's fun, I think in terms of it's amazing any more children get born in this world, like willingly, right?
Right.
Willingly, mothers deciding to have them when they know the way things go. But it's human nature. It's some of us as women, we do want children, and some don't. And I go, if you don't want children, don't have them. Do not have them. Right?
Yeah.
You do not. But you know, in the work that I do, I often see this. Well, I see the story of a birth and how it echoes through a family for generations. And so I'm wondering, do you believe that by preventing birth trauma today, we could actually perform, you know, a form of systemic healing for the whole family as a unit? Like, I mean, if we could prevent it.
Mhm. Oh, yeah. If we yeah, it would be. Like, preventing it is it's interesting. Somebody had asked me, they were like, "Well, do you know how many babies you saved through your
Mm,
book and your efforts to get involved before delivery to help prevent it?" And I'm like, "I know there's some." And I'm like, "But I don't nobody will ever know. They won't know.
no,
I won't know."
no.
Because everybody has a healthy baby. Nobody thinks about it if they unless you're obviously a birth trauma attorney or in our world. But,
Hmm.
hopefully they just had a healthy baby and they went on and, and just enjoyed, enjoyed their little one and growing up and normal and all that. So,
Yeah. Well, your mission is I'm brings tears to my eyes, girl, because I just think what you're doing is amazing. And, to see, what goes wrong and wanting to make sure it doesn't happen to other women out there, you just yeah, you rock. You rock. And our time is up, and I want you to share the name of your book and also to, how people can get in touch with you. I will, when I do the promotion on this episode, I will have that, put on the artwork for sure. But I know people like to hear it
oh
out loud
yeah.
from the person. So what your the title of your book, and where can people get it?
So the easiest place to get my book is Amazon.
Mhm.
And you put my name in, Gina Mundy,
Okay.
and boom, it pops up. And it's called A Parent's Guide to a Safer Childbirth, and then the subtitle is Expecting the Best, How Using the Power of Knowledge Will Help You Have or Deliver a Healthy Baby. And then for anybody who is expecting baby, I do have a podcast
Oh, yeah,
on just
please.
how to yes, and it's called the best place to find it's YouTube. I have I don't have that many episodes, but I have already I think there's, like 78,000 subscribers, and I think I only have, like, 15 episodes.
Wow.
So,
That's
yeah, 'cause
great.
well, they're hungry.
Yeah.
They want everybody you have social media these days, and I know on social media, especially a lot of them show up on my algorithm. You have moms who have had babies that have been brain damaged, and but it's out there, people do see it. So
Mhm.
they are trying to, "Okay, what do I need to do?" So my podcast is really the focus is, safer delivery, what you need to know, the important stuff. I have an episode just for dads, like, "Hey, this is what you need to know."
Right.
Um, and, so to be part of it. And then the best way to get a hold of me is my website, ginamundy.com,
Mhm.
GINAMUNDY.com.
Perfect.
And there's a contact button with my email, and it literally will be come up on my phone.
Okay.
So no matter where I'm at. So
Awesome.
somebody yeah, I was on a show earlier and they're like, "Well, do you think they need a labor or childbirth attorney during labor?" I'm like, "Well, I no." And I'm like, "But wait a minute. Like, I've gotten a lot of calls during labor. Maybe we do. I don't know. But if you do, you guys know how to contact me. Just go to
Exactly.
ginamundy.com and it pops up on my phone. Just put in the heading, I'm in labor.
It's
so,
awesome.
so
I
I know how
love
to
it.
respond immediately.
Oh, that's great, Jean. I love it. Oh my god. Thank you so much. Really. such an honor, and my best and prayers for your daughter and baby and you and hubby and, everyone involved because we really do need a community, and that's the only way we're gonna make it through a lot of the challenges that we have in life, and especially one that is so precious called the bringing in to the tribe a new life, right? A new soul, so, yeah. So thank you so much.
I love that, and thank you for having me, Colli. You're amazing, and it was just a huge honor to be
Oh,
on your podcast today.
oh my god. Blessings. Blessings to you and your family, my dear. Lots of love. Thank you.
Thank you.